In the war against disease, one of the biggest concerns for veterinarians and researchers is the increasing number of bacterial diseases resistant to treatment. As proven antibiotics are failing to kill target microorganisms, science is looking to a more recently studied culprit, the biofilm. Now exists a susceptibility test that for the first time allows for the growth of biofilms in a clinical laboratory and testing for biofilm susceptibility. To learn more about this new test that greatly improves guidance for antibiotic treatment, watch this important message about the revolutionary becSCREEN assay. Using the patented Innovacept technology from proven veterinary leader in diagnostics, Spectrum Labs. becSCREEN is the world's first biofilm susceptibility test in medical diagnostics. Just 10 years ago, the term biofilm was not commonly known in the medical field. Recently, the Center for Disease Control reported that 60% of all infectious disease are caused by organisms existing in a biofilm state, up to 4,000 times more resistant than the same organism in a free-floating or planktonic state. Biofilms are the predominant microbial life form present in nature and will grow on both living and abiotic surfaces. Current MIC tests provide limited useful clinical information as they are only detecting the eradication of planktonic bacteria, which is almost always not the state bacteria are found in when chronic recurrent infections occur. What results is detrimental to the patient and to the veterinary healthcare system, because administering inappropriate antibiotics or exposing bacteria to sublethal doses of appropriate antibiotics is the leading cause of bacterial resistance. Patients don't get better, hospital stays get longer, and costs to pet parents continue to rise without providing a once-and-for-all solution. Consider the economic impact of multiple testing, multiple treatments, and more resistant organisms as this crisis grows, as well as the cost of failure to all parties. Clearly, there is a need for a novel device to determine biofilm susceptibility. becSCREEN is the in vitro diagnostic tool that you need to fight resistant biofilm diseases. Starting with a simple swab of the infected area, it is the only test of its kind that provides bacterial susceptibility at serum breakpoint levels to both planktonic and biofilm states of the organism. Choosing the right antibiotics to treat infections requires an in vitro susceptibility test that closely approximates the in vivo condition. becSCREEN is the world's first veterinary biofilm susceptibility test for single and combination antibiotics for organisms in planktonic and biofilm states. becSCREEN provides improved susceptibility information not only for recurrent skin infections and otitis, but also UTIs, compound fractures, and orthopedic prosthesis, to name a few. Chronic infections are an unprecedented burden on veterinarians and pet parents, as well as a pet's quality of life. Veterinarians require the finest quality of diagnostic tools available to offer the best treatment options for these difficult diseases. becSCREEN is the tool you've been waiting for to help you in the fight for an effective treatment of chronic pet infections. When it comes to better quality of life for patients and a greater efficiency for our veterinary healthcare system, becSCREEN is the only choice in treating any chronically relapsing bacteria infection. For many years, we have been trying to address recurrent chronic infections as if bacteria existed only in their planktonic individual state. But research shows these organisms to be very complex and adaptive to their environment. Some bacteria have evolved to be resistant to the antibiotics we are using to treat them. During the course of infection, microbes can develop into a settled colony environment with other bacteria to form a biofilm state. Biofilm states can occur in any warm, humid, and moist environment. Biofilms are surrounded by an exopolysaccharide layer as a barrier of entry to antibiotics. In addition, the bacteria within a biofilm share genetic information and survival strategies. In fact, many studies have shown a greater than 1,000-fold resistance to antibiotics by biofilms when compared to the same bacteria in a planktonic state. Biofilms can occur in any humid, moist environment. Some of the most common in veterinary medicines are recurrent otitis, recurrent staph pyodermis, interdigital infections, urinary tract infections, catheter-caused infections, orthopedic replacements, compound fractures resulting in skin breakage, gingivitis, and many more. Please make sure to collect the sample from an active infection. Refrain from using antibiotics for 7 to 10 days prior to swabbing and until the MBEC results have been provided. Swab the infected area. If swabbing a dry area, use a few drops of sterile saline on the head of the swab to ensure proper quantity of collected material. If infected area is moist, this is not necessary. Once a sample has been collected, remove the cap from the transport tube and place the swab inside. Modified Amy's charcoal gel is the recommended transport media, but not essential. Please note, for UTIs, a midstream urine sample is required. Place swab in sample for an hour, then submit. Once swab is placed in tube, packaged similarly to a serum sample. Cotton balls to act as shock absorbers inside a sandwich or other sealable bag, etc. Make sure to include your submission paperwork, i.e. order and history form. Remember to record the sample information on the outside of the transport tube. This information should match what is listed on the order/history form. Attach the provided 2-day prepaid FedEx label and call FedEx to schedule a pickup. Bacteria can be stored for up to 4 days in a refrigerator, but do not need to be shipped refrigerated. Normal shipping times are conducive to colony survival and growth. Once your sample has been received, it will take approximately 7 to 10 business days to receive results depending on the growth pattern of bacteria present. Once the sample has been received, it will be plated on several types of selected media to ascertain gram status. The dominant colonies will be gram stained to confirm, and then the appropriate gram-positive or gram-negative antibiotics are used for the assay. Once gram status and growth rates have been determined, the becSCREEN testing will commence. The becSCREEN assay allows us to, for the first time in a laboratory setting, recreate in vitro what is occurring in vivo in our patients. The patented growth device allows us to recreate the biofilms as they are present in the host body and perform an antibiotic susceptibility test on the more resistant biofilm state of the bacteria present. The antibiotics we test, susceptible, intermediate, and resistant status, have been collected based on the most common practice and usage in the U.S. As part of the testing, MIC testing will be conducted along with MBEC or biofilm tests. The comparative nature of providing both results will give you further insight as to why the previous MIC testing was unsuccessful when addressing the bacteria present by noticing the significantly fewer antibiotic options for the biofilm than in the planktonic MIC assay. Approximately 90% of the time, MBEC assay alone will suffice in providing antibiotic solutions. In the other 10% of the time, additional assay may be necessary. In these cases, the listed veterinarian will be notified of the MBEC findings and what additional tools the specific case requires. These scenarios include both gram-negative and gram-positive bacteria present. The bacteria identified is Pseudomonas aeruginosa. Combo panel run. The bacteria identified is 100% resistant to all single antibiotics tested. Combo panel run in addition to the original MBEC panel. These additional scenarios and their costs are listed on the bottom half of your order forms. Once the sample has been processed, you will receive a report on the findings and treatment recommendations. As part of the results reporting, MIC or planktonic results will be reported along with the MBEC biofilm results. It is the MBEC antibiotic susceptibility results that you will want to base your treatment options on. The MIC results are provided for comparative purposes only, giving you further insight as to why the previous MIC testing was unsuccessful when addressing the bacteria present. Once we know what antibiotics we can use for treatment, what are the next steps? Once the results have been reported, you can prescribe antibiotics at the manufacturer's recommended dosage. What does a sample without growth indicate? No growth on any of the agar plates will often indicate that there is no aerobic bacterial infection. There may also be the possibility that the infection is bacterial, but the swab wasn't performed properly. Swab should be hydrated with saline, for example, before swabbing the infected site. It is also possible that the infection may be caused by yeast, anaerobic bacteria, or virus. What are the options when a sample is resistant to all antibiotics? In cases where bacteria are resistant to all single antibiotic treatment, a secondary screen is run to allow for the testing of 35 antibiotic combinations to determine alternate treatment options. The testing is done after the veterinarian has been notified of the findings of the completed assay and provided approval to run any additional panels at an additional cost. Chronic infections are an unprecedented burden on veterinarians and pet parents, and to a pet's quality of life. Veterinarians require the finest quality of diagnostic tools available to offer the best treatment options for these difficult diseases. becSCREEN is the tool you've been waiting for to help you in the fight for effective treatment for chronic pet infections. When it comes to better quality of life for patients and greater efficiency for our veterinary healthcare system, becSCREEN is the only choice for treatment of biofilm diseases. becSCREEN, putting an end to recurrent bacterial infections once and for all.